Okay, today we're going to talk about the Medaneb. Here's my Medaneb machine I'm going to use today. So, before entering the patient's room, of course, we're going to check their chart, make sure we check any contraindications that they may have. It's pretty much the same as the EZ-PAP, untreated pneumothorax, hemoptysis, sinitis, any facial trauma, the only other thing is, though, we don't really need the patient to be alert and oriented to use this therapy. So um, we can use this on a patient who is trached. We can use it with a face mask or with a mouthpiece, and we'll go ahead and collect our supplies and our medication before we enter the patient's room. So upon entering, we'll introduce ourselves. Hi, my name is Kate. I'm with Respiratory, and today it looks like the doctor has ordered you to do our Medaneb therapy. What that's going to do is do a couple or three things actually. It's aerosol delivery, so we're going to give you some medication. It's going to do lung expansion and then also secretion clearance. So one of the most important things you can do is go ahead and when you're putting your mouth on this mouthpiece, you're going to make sure you have a nice tight seal. We need you to keep a tight seal. We can put a little nose clip on you if you are having trouble breathing through your mouth. But we can also do a face mask as well. It's not going to be an aerosol face mask. It's going to be an anesthesia face mask because, again, we need that tight air seal with the positive pressure coming in. So we'll go ahead and put the medication in here in the device. You can open it, go ahead and put your meds in or just saline. And we'll hook up the tubing to the Medaneb. It kind of goes in this port right here. You'll see a little insert and then you twist down to lock it into place. We're going to be, there's an on switch on top here. We'll go ahead and click that on. Go ahead and have the patient insert the mouthpiece into their mouth, having that tight seal. And the first thing we're going to start them off on is a low flow and on the aerosol. So we'll click this right here to the aerosol. We'll do that for like 2.5 minutes. And then we'll go ahead and click them to continuous high flow oscillation. With this, we can increase their oscillatory pattern or decrease it a little bit. We're really going to be watching this manometer here. We need them in between 10 to 15, and we'll increase that with the flow of the Medaneb. We're going to do the continuous high flow oscillation for 2.5 minutes. Click them down to the aerosol therapy again, give them a break. We definitely want to be watching their pressures here and also the respiratory rate. You get lightheaded and dizzy, it is quite a workout, to be honest, especially if you're ill. If you just had heart surgery or things like that, it's quite a workout. So then we'll go ahead and after we give them a little bit of break on the aerosol delivery, we'll click them down to the continuous positive expiratory pressure. And that's just like the EZ-PAP that we talked about earlier. And again, we're just having the patient breathe normally in and out throughout this therapy. It does last about 8 to 10 minutes though through this therapy. Again, we were watching them the whole time though to make sure that they're not hyperventilating through it. After the therapy, we'll go ahead and listen to their breath sounds, monitor their work of breathing and their respiratory rate. And we should see a decrease in the work of breathing. Their lung sounds should have cleared, and or we should produce some coughing through this and expelling the expectorating the secretions that they had. So that's about it.